Now, having done all that and gone through all the breast cancer, let's just finish off for a few minutes with some of the non-cancer, we call benign breast problems that we see. Breast cysts are very common, particularly between 40 and 60. I often call them water cysts. They're full of fluid. It can be yellow, it can be brown, it can be green. They are nothing to do with breast cancer or breast cancer risk. If they're troublesome and they're big, we can put a little needle in, usually with the ultrasound scanner on a little needle, and drain the fluid off and they go away. Ladies who get cysts tend to be prone to cysts for quite a few years. And although they know they've got another cyst, it's very important. If you get a lump, you must always get a lump checked, even though ladies who get cysts get cysts. Again, nothing to do with breast cancer or breast cancer risk. They must be something to do with how the sensitivity of the breast changes. They're not due to hormone levels per se, but as you get less young, you get more prone to breast cysts. Fibroadenomas are harmless lumps, particularly common in young ladies. You might hear them called breast mice, because that's what they referred to in years gone by. They're fairly mobile, they're round and smooth. Again, they are completely harmless. They are nothing to do with breast cancer and breast cancer risk. We will often biopsy these to prove that's what they are, because once we know it's a fibroadenoma, they can safely be left alone. The frozen pea syndrome thing, I'm afraid, is a Marsh invention. And as you get, particularly ladies into your mid-30s, the breast tissue can go really knobbly. And I often describe it, and it's a bit unflattering, I know, but I think you'll know what I'm talking about. It just feels like a bag of frozen peas. Now, there are two things in the breast. The bottom half, even when you're slim, is mostly fatty tissue, so it's softer. And it's up here, the top bit, particularly the bit towards the armpit, you get the knobbly gland tissue that I call the frozen pea syndrome. Really common. And when you take frozen peas out of the freezer, they clump, and breast tissue will do this, and you will get clumps of often quite tender knobbly gland tissue that feel like proper lumps. So again, you always get it checked, but it's all part of this Marsh frozen pea syndrome thing. It is harmless and nothing to do with breast cancer and breast cancer risk. Similarly, breast pain on its own is not a sign of breast cancer or breast cancer risk. It's very common, and particularly in younger ladies. And again, it's a hormone related thing, but again, it's not related to the level of hormones. There must be a breast sensitivity thing in there as well. And it can be really distressing, it can. And I did have a lady quite a few years ago say to me, I bet if men got breast cancer, you'd have cured it by now. But what it actually demonstrates is that ladies are complicated and men are simple, because ladies, you have all the different hormones interacting that somehow causes breast pain. It tends to come and go irregularly. My experience is it's often not related to the cycle, it's random throughout the cycle, and it is somehow to do with hormones. Now, even older ladies will get this, so ladies past the menopause will get this. Because although your ovaries are not making estrogen, you still make it in the tissue under the skin. And now and again, I think you get a little blip of estrogen. It goes up slightly, not to the level it used to be when you were young, but it goes up a bit. What happens is the breast tissue goes, well, hormone, we're having that, and it all ends up in the breast and makes the breast tender. So often when you push, particularly out the side or the top bit, you will find your breast is tender. It is harmless. Okay. It's not related to breast cancer or breast cancer risk, but it can be distressing. And often ladies will come along with breast pain, we can do some mammograms, we can prove it's harmless, and actually that's a very reassuring thing. Some ladies take paracetamol, some take Nurofen. Younger ladies will often take evening primrose oil, which I find will decrease the amount of pain you get. It doesn't get rid of it completely. And it is a real nuisance, but it's fairly straightforward to prove. It's not worrying. So hopefully all that has helped. This graph I use quite a lot, actually, when I'm talking to doctor medical students, just illustrates the incidence of different things as you get older. So along the bottom is your age, and you can see these harmless fibroadenomas happen in young ladies. Cysts happen as you get between 40 and 60, and breast cancer, as we've said, is disease of older ladies. And then you get this diffuse nodularity, this packet of frozen peas, which really hits its peak when you hit your 30s. So I often tell, for example, GPs, medical students, if I'm talking to them, that's the one thing to remember about the different things you get at different ages.